Jordan, we're going to go into 3 and we're going to see Kathy. And Kathy is a female patient of Hispanic origin and she's here complaining of a sore throat.
I decided to go into nursing as a career because, first of all, I love science. I love the science of the human body and how it works. And I also love to interact with people.
So Jordan's going to take your vital signs and we're just going to ask you a few questions about your symptoms. We've been involved with Amaus since it opened in July of 2007 to open a clinic for the underserved with a dual mission. A mission of patient care and a mission of education of future healthcare providers.
The clientele that come into Amaus usually are people who don't have any insurance. Sometimes it's people off the street, but sometimes it's people that have jobs here and there but still don't have any insurance.
The benefits to the student, from my perspective as an educator, is their ability to become involved in their own local community as part of their education experience.
You get to see a lot more of the members of the community than you would normally see. A vital part of being a nurse is the bedside manner. You get to go out and practice that, and especially for people who have no clinical experience, to be able to practice their bedside manner with people like this is very important for when they do go out and start being a nurse.
We primarily want them involved in direct patient care. We want them to interview patients, we want them to hear their stories, learn that there's a role for the nurse outside of acute care in caring for people in all different types of settings, and all kinds of people need the help of a nurse. Kathy, does anything hurt? Do you have any pain?
It's a very different scope of practice because you're serving people who, you know, this is the only thing they have. This is the only way they can get medical service, you know, and they can't pay for it.
By coming down here, they're seeing the needs of the community through actually taking care of people who are the neediest in our community.
They walk in and they have no idea that they could be at risk for diabetes or, you know, no idea that they have high blood pressure until we check their vital signs or we check their blood sugar.
Students tell me that overwhelmingly that they love this experience. I had a student recently who told me that after her 2 days here at Amaus that she spent with me, that she felt that this was the first time in her life that she was a real nurse.
This experience is only going to help me to be a more well-rounded medical professional and a more well-rounded person.